Gallstones are solid crystalline deposits that form within the gallbladder or biliary tree. The terms that we use for gallstones actually change dependent on their anatomical location. Cholelithiasis refers to a stone that is present within the gallbladder, whereas the term choledocholithiasis refers to a stone that lies within the biliary tree, typically the common bile duct or CBD. Biliary colic and acute cholecystitis are two conditions that fall within a spectrum of gallstone diseases, as well as cholangitis, which we'll cover elsewhere. In a nutshell, biliary colic is when a stone temporarily lodges in the cystic duct or CBD, and this causes pain. Whereas in acute cholecystitis, the stone blocking the cystic duct persists, resulting in inflammation and subsequent infection. Before we focus more on the respective conditions, we first need to cover some basics of anatomy and physiology. The gallbladder is a reservoir that is responsible for storing and concentrating bile that's produced by the liver. It's shaped like a slightly elongated pear and sits underneath the liver, as you can see here. We can also see how the gallbladder lies slightly superior and lateral to the duodenum and pancreas. The gallbladder has the capacity to store around 30 to 60 millilitres of bile, and it's during periods when the individual is fasting that the gallbladder is more filled. The gallbladder is covered by a thin layer of peritoneum and is connected to the common hepatic duct via the cystic duct. The gallbladder itself can be divided into four parts: the fundus, the body, the infundibulum, and the neck. Regarding the biliary tract, the extrahepatic biliary tract starts with the right and left hepatic ducts, and these join to form the common hepatic duct. The common hepatic duct is located anterolateral, or in front of and to the side of, the hepatic artery. As we move inferiorly, the common hepatic duct receives the cystic duct, which comes off the gallbladder, and it's at this point that the common bile duct, or CBD, is formed. The CBD continues inferiorly, passing behind the first part of the duodenum and along the posterior surface of the pancreas, where it joins the pancreatic duct. Together, the CBD and pancreatic duct drain into the second part of the duodenum via the ampulla of Vater and sphincter of Oddi. The arterial supply to the gallbladder is from the cystic artery, which is typically a branch of the right hepatic artery. When we talk about the cystic artery, we have to think about an anatomical space called Callot's triangle, which was named after the French surgeon Jean-François Callot, who practiced in the late 19th and earliest 20th centuries. Callot originally described a triangular anatomical space that was formed by the cystic duct as the inferior border, the common hepatic duct as the medial border, and the cystic artery as its superior border. Interestingly, with the passage of time, our perception of Callot's original triangle has become slightly modified, and we now commonly assume the inferior border of the liver as being the superior component of the triangle, with the cystic artery running within this triangle. Now, whilst this isn't anatomically correct, and in keeping with what Callot originally described, the important thing to remember is that after coming off the right hepatic artery, the cystic artery traverses this space on its way to the gallbladder. And in the process, depending on whether you stick to the original definition or not, creates the superior border of Callot's triangle, or passes through the middle of the triangle. This means that when we operate on this area, for example during a laparoscopic cholecystectomy, if we can identify Callot's triangle, then we can aim to locate the cystic artery on its way to meeting the gallbladder. Therefore, we can be pretty confident that this structure that we plan to clip off and cut will not be something vital such as the hepatic artery, common hepatic duct, or CBD, which obviously we'd want to avoid accidentally cutting at all costs.